Staph infection. The best treatment options. Staphylococcus is a group of bacteria that can cause a multitude of diseases. Staph infections may cause disease due to direct infection or due to the production of toxins by the bacteria. Boils, impetigo, food poisoning, cellulitis, and toxic shock syndrome are all examples of diseases that can be caused by Staphylococcus. Symptoms and signs of a localized staph infection include a collection of pus, such as a boil, furuncle, or abscess. The area is typically tender or painful and may be reddened and swollen. Methicillin-resistant Staphylococcus aureus, known as MRSA, is a type of Staphylococcus aureus that is resistant to the antibiotic methicillin and other drugs in this class. Staph infections are treated with topical, oral, or intravenous antibiotics, depending upon the type of infection. Staphylococcus is a group of bacteria that can cause a number of diseases as a result of infection of various tissues of the body. Staphylococcus is more familiarly known as staph. Staph-related illness can range from mild and requiring no treatment to severe and potentially fatal. The name Staphylococcus comes from the Greek staphyle, meaning a bunch of grapes, and kokkos, meaning berry, and that is what staph bacteria look like under the microscope, like a bunch of grapes or little round berries. Over 30 different types of Staphylococci can infect humans, but most infections are caused by Staphylococcus aureus. Staphylococci can be found normally in the nose and on the skin of around 25% to 30% of healthy adults and in 25% of hospital workers. In the majority of cases, the bacteria do not cause disease. However, damage to the skin or other injury may allow the bacteria to overcome the natural protective mechanisms of the body, leading to infection. Risk for staph infections. Anyone can develop a staph infection, although certain groups of people are at greater risk, including newborn infants, breastfeeding women, and people with chronic conditions such as diabetes, cancer, vascular disease, and lung disease. Injecting drug users, those with skin injuries or disorders, intravenous catheters, surgical incisions, and those with a weakened immune system due either to disease or a result of immune-suppressing medications all have an increased risk of developing staph infections. Staph infections are contagious until the infection has resolved. Direct contact with an infected sore or wound, or with personal care items such as razors, bandages, etc., are common routes of transmission. Casual contact such as kissing or hugging does not pose a great risk for transmission if there is no direct contact with the infected area. Symptoms and signs of a staph infection. Staphylococcal disease of the skin usually results in a localized collection of pus, known as an abscess, boil, or furuncle, depending upon the exact type of lesion that is present. The affected area symptoms may be red, swollen, and tender or painful. Drainage or pus is common. When staph is in the blood, bacteremia or sepsis, it can cause high fevers, chills, and low blood pressure. Types of diseases are caused by staph. Skin infections are the most common type of disease produced by Staphylococcus. Staph infections of the skin can progress to impetigo or cellulitis. In rare situations, a serious complication known as scalded skin syndrome can develop. In breastfeeding women, staph can result in mastitis or in abscess of the breast. Staphylococcal breast abscesses can release bacteria into the mother's milk. When the bacteria enter the bloodstream and spread to other organs, a number of serious infections can occur. Spread of the organisms to the bloodstream is known as bacteremia or sepsis. When staph bacteria are present in the blood, the condition is known as staphylococcal bacteremia. Staphylococcal sepsis, characterized by low blood pressure, fever, and chills, is caused by staphylococcal bacteremia. Staphylococcal sepsis is a leading cause of shock, circulatory collapse, and death in people with severe burns over large areas of the body. Staph bacteria spread to other organs. They may cause various conditions. Staphylococcal pneumonia predominantly affects people with underlying lung disease and can lead to abscess formation within the lungs. Infection of the heart valves can lead to heart failure. Spread of staphylococci to the bones can result in severe inflammation of the bones known as osteomyelitis. Septic arthritis occurs when staphylococci infected joint space. Thrombophlebitis occurs when the bacteria infect a vein. Thrombophlebitis from staphylococci most frequently occurs in hospitalized patients at the site of a venous catheter. Staphylococcal infections are contagious and can be transmitted from person to person. Since pus from infected wounds may contain the bacteria, proper hygiene and hand washing is required when caring for staph-infected wounds. Staphylococcal food poisoning is an illness of the bowels that causes nausea, vomiting, diarrhea, and dehydration. It is caused by eating foods contaminated with toxins produced by Staphylococcus aureus rather than a true infection with the bacteria. Symptoms usually develop within 1 to 6 hours after eating contaminated food. The illness usually lasts for 1 to 3 days and resolves on its own. Patients with this illness are not contagious since toxins are not transmitted from one person to another. Toxic shock syndrome is an illness caused by toxins secreted by S. aureus bacteria growing under conditions in which there is little or no oxygen. Toxic shock syndrome is characterized by the sudden onset of high fever, vomiting, diarrhea, and muscle aches, followed by low blood pressure, which can lead to shock and death. There is often a rash resembling sunburn, with peeling of skin. Toxic shock syndrome was originally described and still occurs especially in menstruating women using tampons. Tests do healthcare professionals use to diagnose a staph infection. In cases of minor skin infections, staphylococcal infections are commonly diagnosed by their appearance without the need for laboratory testing. More serious staphylococcal infections such as infection of the bloodstream, pneumonia, and endocarditis require culturing of samples of blood or infected body fluids or tissues. The laboratory establishes the diagnosis and performs special tests to determine which antibiotics are effective against the bacteria. Treatment for staph infections. Minor skin infections are usually treated with an antibiotic ointment such as a non-prescription triple antibiotic mixture. In some cases, oral antibiotics may be given for skin infections. Additionally, if abscesses are present, they are surgically drained. More serious and life-threatening infections are treated with intravenous antibiotics. Treat staph infections. Staph infections may initially be treated by primary care practitioners including pediatricians, internists, and family medicine specialists. An emergency medicine specialist may treat the patient if he or she seeks care in an emergency department or urgent care center. Sometimes with skin infections, people seek treatment from a dermatologist. For more severe infections, bloodstream infections, or infections of the internal organs, a number of specialists may be required, including infectious disease specialists, cardiologists, critical care specialists, pulmonologists, and surgeons. Complications of staph infections. Scalded skin syndrome is a potentially serious side effect of infection with staph bacteria that produce a specific protein that loosens the cement holding the various layers of the skin together. This allows blister formation and sloughing of the top layer of skin. If it occurs over large body regions, it can be deadly, similar to a large surface area of the body having been burned. It is necessary to treat scalded skin syndrome with intravenous antibiotics and to protect the skin from allowing dehydration to occur if large areas peel off. The disease occurs predominantly in children but can occur in anyone. It is known formally as staphylococcal scalded skin syndrome. Prevent staph infections. No vaccine is available against Staphylococcus aureus. Since the bacteria are so widespread and cause so many different diseases, prevention of staph infections requires attention to the risk factors that may increase the likelihood of getting a particular type of staph infection. Prognosis for staph infections. The prognosis or outcome of staph infections depends upon the type of infection that is present as well as other factors such as the extent to which the infection has spread and the underlying medical condition of the patient. Skin infections and superficial infections, in general, are readily cured with antibiotics. In rare cases, these infections may spread and cause complications, including sepsis. It is important to remember that even after taking antibiotics for a staph infection, you can still develop a repeat infection.